ভিডিওটি হোমিওপ্যাথিক চিকিৎসক বন্ধুদের দেখানোর জন্য এবং শেখানোর জন্য। This is a grave disease. This gentleman age only about 48 years. The ordinary simple person of the society age only 48 years has been suffering from cholangiocarcinoma. Cholangiocarcinoma. What is cholangiocarcinoma? That means CA of the bile duct. CA of the bile duct, including the cystic duct and bile duct. There is a growth. There is a tumor developed. See, this is the MRI report. Soft tissue involving the neck of the gallbladder and also including common hepatic duct and common bile duct. This is the MRI done from the Asian Institute of Gastroenterologists Center of Hyderabad. This is the MRCP of the previous local hospital, MRCP of the soft tissue noted in the common bile duct, giving compression in the biliary tract. So, only C of the gallbladder is known as C of gallbladder. Only C of the liver is called C of liver. But C of the common bile duct is known as cholangiocarcinoma. So this is a case of cholangiocarcinoma. The growth in the common bile. You know there are two hepatic ducts. This is right hepatic duct and this is the left hepatic duct. Forms the common hepatic duct. And the common hepatic duct যখন জুড়ে যাচ্ছে with the gallbladder duct is known as cystic duct, forms the bile duct. So growth here is the growth. This is the portrait picture. This is the original MRCP picture. These are the hepatic duct coming from the smaller hepatic ducts. Two hepatic duct, common hepatic duct, gallbladder, cystic duct, joining of the hepatic duct and cystic duct, this is bile duct. So, a very sad case. Tumor or growth in the common hepatic duct, in the bile duct. Now, it has once again confirmed by the another blood test which is known as CA 19.9. CA 19.9 test, which normally the level is generally within 27. It has increased up to 312. So CA 19.9 is also increased. So this patient has returned from the Asian Institute of Gastroenterology Center of Hyderabad because the operation is difficult to do. There is chance of metastasis. So the survival rate is very low. Poor, prognosis is not in favor. But for palliative measures, what we can do? Now the weakness, durbalata, loss of appetite, khide nei, no stool, all are common symptoms of the disease. Liver is not acting properly, gallbladder is not acting properly, there is no discharge of bile from the gallbladder via cystic duct. It is obstructing it is obstructing in the site of the gallbladder, in site of the lesion, where there is tumor formed. The bile is not entering into the common bile duct and it not entering into the duodenum. So there is obstruction of the bile. So bile obstruction হলো কি হয়? Bile goes again, return, that is called feedback mechanism, and gallbladder is filled up by bile. Then the bile enters into the liver again and enters into the blood, and the bilirubin enters into the blood. The excess of bilirubin, when enters into the blood, when goes to the blood, the change of the color of bilirubin is to be shown. So it is expressed as the yellowish discolorations of the conjunctiva, sclera, and skin. See, there is mass yellowness of the conjunctiva. So these are the common symptoms. Loss of appetite, খিদে নেই, ঘুম নেই. Now, chulkani, itching of the whole body due to bilirubin. Now we shall find out some uncommon symptoms. If we prescribe or you want to prescribe for palliative purpose even, we shall look after some uncommon symptoms. The uncommon symptoms in this case is thirstlessness. পিপাসাটা হচ্ছে না একদম। সো সাধারণত এরকম ডিহাইড্রেশন কন্ডিশান, যেখানে খিদে নেই, ডিহাইড্রেশন কন্ডিশান, সেখানে পিপাসাটা থাকা উচিত ছিল। Now the patient is thirstless. So this is a uncommon symptom, thirstless. And there is chilliness, শীত করছে বেশি, chilliness. So chilliness and thirstlessness and the pain with chilliness led me to think of pulsatilla. So when we want to make a constitutional treatment or even for a palliative treatment, symptomatology or few symptoms are the sole guide of our prescription. So let's think about pulsatilla for palliative purposes and see the result. Understand? Palliative medicine. ওই কষ্টটাই বুঝিয়ে বললাম ডাক্তারদের, দেখি কতটা আপনাকে রিলিফ দিতে পারি।